The Department of Health and Welfare back in front of the Joint Finance and Appropriations Committee, this time focused on early learning and development, public health services, and family and community partnerships. The department is asking for, and Governor Little recommends, funding for new full-time positions to make up a program integrity staff. One of those positions including a dedicated fraud investigator. Department Director Juliet Sharon taking questions from lawmakers.
We all collectively want to make sure that funds are going to the places that they should be going, and they should be used appropriately. And we need to be rooting out fraud, waste, and abuse.
It's currently unclear how much, if any, fraud is happening in the program, but Sharon says her team is working on a, quote, 360 review of all child care providers in the Idaho child care program. The department is also asking for budget restorations for HIV and hepatitis C prevention and surveillance programs. These programs have the goal of preventing new infections and reducing the spread, focusing on education, screening, and testing. This comes as Idaho is seeing an increase in HIV cases throughout the state.
That there's still a need in our Idaho communities for these services, be it, again, education, prevention, or the screening.
Another restoration request is for the Immunization Assessment Fund. Funding was shifted to one-time allocation for 2026 and is set to cease operations in 2027 if the funding doesn't get restored. This fund provides free or low-cost vaccines for families or guardians who wish to vaccinate their youth. I will continue to follow all budget discussions within the legislature as they move through the process. Follow along to stay updated.